Are you tired of living with chronic back pain, sciatica, or a herniated disc? Have you thought about using a back brace and asking yourself, do back braces really work, or are they a gimmick? In this video, I will debunk the myths and uncover the truth about back braces, how they could be the solution you've been searching for. I will explain the science behind them and share real-life experiences from people just like you, and reveal one of the best back braces for pain relief. In addition, you will learn how to use back braces effectively to stop back pain in its tracks and get back to living your life. You may have heard mixed reviews. Are they a miracle cure or a waste of money? If you're ready to take control of your pain and discover the best back brace for your needs, keep watching. Not only am I going to reveal to you this one-of-a-kind back brace, but I will also teach you how to use it properly, position it, secure it, adjust it, and check it for absolute comfort. You will also learn how this unique back belt works to enhance support and stability, help relieve back pain, and improve mobility. This is crucial for patients who are recovering from an L4-L5 disc bulge or an L5-S1 disc bulge. And perhaps the most important part that you should not miss when to wear it and when not to wear it. Hi, I'm Dr. Ruminder Birk, a chiropractor in Woodbridge, Ontario, Canada, with over 24 years of clinical experience. We have helped thousands of patients recover from spinal conditions such as disc bulges, herniations, degeneration, lumbar stenosis, sciatica, and radiculopathy. We use non-surgical spinal decompression as the cornerstone of our unique and proven back to life method. Be sure to hit that subscribe button if you want do-it-yourself tips, strategies, and exercises that will help you relieve and manage your back pain and leg pain at home. Plus, you will discover which therapies are the best for treating disc bulges, disc herniations, and other spinal degenerative conditions. I'll upload a new video every week. Be sure to comment and tell me you subscribed, and I will personally reply back to you. In addition to that, I wrote a book called Back to Life. Imagine getting your life back while getting your health back. You can get a free copy at the link pinned in the comments below. So the first thing you should know is that anyone can incorporate a back support or a back brace into their daily routine, at home and at work, as part of a multimodal approach to treating L4-L5 disc issues. In this video, I'm going to answer some of the key questions most people have. When is the back support needed? Why should it be combined with spinal decompression as a treatment program for disc injuries? How does the back support help these injured discs? Why all back supports are not created equal, and why not to use the bulky bodybuilding or full spine coverage back supports. Remember, in my other video we spoke about keeping it simple, silly. You don't need anything fancy, all these bells and whistles. You need it to be functional. Break down some of the myths and truths about lumbar back supports. So the first myth is lumbar supports are only for people with severe back problems. The truth is lumbar supports can be beneficial for a wide range of back issues, from minor strains to more severe conditions. They can also be used preventatively during activities that place extra stress on your spine, such as heavy lifting or prolonged sitting. Truck drivers, taxi drivers, people working on construction sites, golfers, you name it, sitting at a computer, anybody can use a back support for certain times of the day. Second myth, lumbar support can cause long-term damage to your spine. There is no evidence that proper use of a lumbar support causes long-term damage. On the contrary, they can help prevent further injuries by providing stability and promoting proper posture during activities that might otherwise strain your spine. The next myth, you should never use a lumbar support because it will make you dependent on it. That is absolutely not true. Lumbar supports are meant for temporary and situational use, providing relief during acute pain episodes or specific activities that strain your back. When used as part of a comprehensive treatment plan that includes therapies, exercises, spinal decompression, they do not lead to dependency. Myth next will be about lumbar supports weakening your back muscles. Again, not true when used properly. They are designed to provide temporary relief and support, not to replace for muscle strength. So when used appropriately, they will alleviate the pain, allow you to perform proper strengthening and activities in proper form so you don't go and damage your disc or back further. So that's what we're going to talk about next. What is the best back brace if you're suffering from an L4-L5 disc bulge, back pain, leg pain, any of those conditions, we're going to talk about what's the best back support that I've come across over many years of practice. I'll be recommending the most effective back support for you. So after countless years of trial and error, I've come to the conclusion that the most simplest format for a back support is effective. So the most effective one that I've come across is the BaxMax. So this brace is simple, easy to use. So why we use this one is because the back support has a unique feature that allows you to incorporate an ice pack for easy application exactly where the relief is needed. And also the BaxMax lumbar back support is lightweight, breathable, it can be adjusted on the fly, but that's not all. It's got countless effects on enhanced support and stability. It has a high tension cable system. It uses a patent pulley system with high tension cables, allowing users to achieve significant compression while supporting. It allows us to have 5 times more compression than traditional elastic back braces. The customizable fit with a pulley system gives us the precise customizable fit that ensures the support conforms closely to the contour of the lower back of the user. The next benefit is going to be obviously pain relief. So with spinal alignment and supporting the natural curvatures of the spine and promoting proper alignment, the BaxMax can alleviate pain caused by the poor posture, muscle strain, and the spinal misalignments. Reducing the pressure, the compression helps reduce pressure on the vertebrae, the lumbar spine, and discs, which can relieve pain associated with the conditions such as herniated discs, sciatica, degenerative disc disease, and L4-L5 disc bulges. Improved range of motion. The lightweight and flexible design of the BaxMax allows for greater range of motion compared to bulkier back braces, and this can help users maintain mobility while still receiving support. Also, obviously when you're doing your activities, so activity support, whether engaging in your physical activities at the gym, exercising, or simply performing daily tasks, the BaxMax provides stability without restricting your range of movement. Comfortable, durable, breathable materials made for high quality breathable materials, the BaxMax ensures comfort during prolonged use. The materials help prevent overheating, skin irritations, and it's long lasting. The durable construction of the BaxMax makes it suitable for long-term use, providing consistent support over a long period of time. The most important thing is going to be the ease of use. Simple adjustments. The pulley system is designed for easy on-the-go adjustments, allowing users to quickly tighten or loosen the support. If you need to breathe, if you feel constricted, it makes it convenient to use throughout the day, adapting to many variable lifting and activities of your daily life. The main point here is that it's quick, easy, on and off. The BaxMax can be put on and taken off quickly, making it practical for individuals with busy lifestyles. I like the versatility, using it for various conditions. The BaxMax is effective for a wide range of back problems, chronic conditions, post-surgical recovery, and usable in many settings at home, at work, exercise, recreational activities, providing versatility and support wherever it is needed. So we're going to get into how to use the BaxMax. So next we have the BaxMax. So this is the actual belt. It's very easy and practical to use, very breathable material, as I had mentioned. The plates create the rigidity we're looking for. The mesh creates the flexibility and breathability. The Velcro makes it easy to put on. So basically on the back support, we've got the 2 plates. The marking on the tags here tell us right and left. Also, I like to remind patients that this is the left side with the ring that will be used as the pulley part to create the tension we're looking for on their spine. So the great thing about this belt is that there's ice that can be Velcroed right on here to the exact location on the lumbar disc area that I want to target for you. You don't need to ice your whole body, but the main effect is to localize the ice to get the best results, especially after treatment. So patients leave with the ice packs on. The nature of this ice pack is it'll melt in about 20 minutes, and you simply remove it, put it back into the freezer, and I like you to ice 2 or 3 times a day. So Donna's going to show us how to place this on. The last thing I forgot to mention is that there are plates here that we can slide in to increase the rigidity if I find that the patient is really uncomfortable, needs more support to really stay rigid. But most times we use it as I've said here with the ice packs. So Donna will place that on for us, going around to the left and right properly with the pulley system. So exactly placed on the lumbar spine. Donna's going to place that so it's supporting the lumbar spine and the top of the pelvis. We use that by Velcroing it in the first patch here. The Velcro closes the belt. Then she's going to go ahead and pull that pulley to create that tightening effect. And you can see that the belt closes the back end. So by tightening and creating a nice support, it's creating a constriction on the spine, and it creates the stability that we're looking for. And the support on the exact area is going to maintain the posture throughout the day. So when Donna leaves, she sits in her car, she's not going to go and slouch. She's going to get that straight posture that we're creating, supporting, stabilizing, and allowing that disc to stay hydrated as we've gone through decompression treatment. We don't want her to go home and compress that spine. So wearing it all day long. I usually recommend patients wear it throughout the day as much as possible, taking that ice pack on intermittently and using this throughout the day. Take it off at night. There are patients who've been wearing this at night if they feel like they have so much difficulty turning in their bed, getting in and out of bed in the morning. Some patients have chosen to wear this throughout the night. The nature of this belt, the breathability of it, I allow that because I think it works overnight if needed. But basically, as Donna's using this, and there are times that you may need to loosen it, the benefit is, as we have the Velcro here, the pulley system allows, if you could just turn that way for me, the system allows us to loosen and tighten the belt as needed on the go. So, you know, if you're feeling constricted, you can't breathe, or you just had a big meal, you can loosen that up for a bit, but then we can tighten it back up as needed. So that's the great benefit of having the BaxMax. That's the best support I've come across, practicality and support at the same time. So when it comes to the duration of how long you should use the BaxMax lumbar support, it really depends on your individual needs, the nature of your back issue, and the advice of your healthcare professional. So here are the general guidelines. Short-term use. It's for acute pain relief. And the duration is for using the BaxMax for several hours a day during episodes of acute low back pain, such as after an injury or during a flare-up of a chronic condition. It can be worn continuously, like I said, for short periods all day long, a few days to a week until the acute pain subsides. Now, when it comes to long-term chronic conditions, the situation here is a degenerative disc disease or ongoing long-term back pain. The BaxMax can be used daily for effective long-term episodes and periods of long-term benefit. But it is important to integrate it with all the other treatments and lifestyle adjustments that come with the proper care. Wear it during all activities that typically cause discomfort, such as lifting, prolonged sitting or standing, or during exercise. It is advisable to use it several hours a day, but not continuously all day long. So you have a choice when it comes to using your back brace. It's not forever, but there's a gradual reduction over time, focusing on your priorities during treatment and during times of need. So basically, the main idea here is we're going to use the BaxMax belt initially more often. I want you to create stability, support that posture, create the healthy habits, and then as your relief comes through proper treatment and care, the BaxMax is used on an as-needed basis. Used at the gym, used at the office, going for long walks, going for grocery shopping. There's specific times patients learn to use the belt. And always remember, like anything else you see online or on YouTube, it's always best that you consult with a healthcare provider that actually examined you. Always consult with the healthcare provider to determine the appropriate duration of your specific condition, the treatment, the personalized advice based on your medical history and the nature of your back pain. Remember to have someone monitor and pay attention to your body's responses during treatment. If you experience any increased pain or discomfort, adjust the duration and consult your healthcare provider when it comes to using devices and things at home care. When it comes to healthcare, we always want to make sure you're in the right hands getting the proper care you deserve. Now, by following these guidelines, you can effectively use the BaxMax lumbar back support to manage your low back pain, sciatica, L4-L5 disc bulge, while promoting overall back health and strength. If you learned something new about back supports, leave a comment and let me know. Also, tell me if you already use a back support. and how has it worked out for you? How does it compare to the BaxMax lumbar back support? Now, if you found value in this video, or you know someone that needs to learn about lumbar back supports, please share this video and go ahead and subscribe to my channel. Now, if you want more do-it-yourself tips, strategies, and exercises that will help you relieve and manage your back pain and leg pain at home. The next video you should watch is this one if you want to learn about disc bulges from pain relief to permanent relief. Go ahead and watch the video next.